So you're labouring at home and everything feels great. But how are you meant to know when to go to the hospital? What if you go too soon? What if you go in too late? Hi mums, I'm Melanie from Better Birth Stories, and my channel is here to help you with everything to do with fertility, pregnancy and giving birth. I'm a hypnobirthing teacher with years of experience in supporting pregnant women and their families. So please subscribe and hit the bell as I release a new video or MP3 every single Monday. So, to great excitement, you have become aware that your labour is starting. And although it might have been a little stop and start to begin with, you are aware now of a regular pattern occurring. When should you be transferring to hospital, or when should you be calling your home birth team to come and support you at home? We know that women arriving at hospital too early can be sent home or are at risk of having their labour artificially sped up, which is not always conducive for a comfortable or positive birth experience. So here are my top 7 observations for you to notice and use as a guide for when to travel to your maternity service. And remember, this video is as much for your birth partner as it is for you, so do make sure that they are watching this with you. 1. That early labour of you watching Netflix and chatting on your phone has now passed. If you were out, then you have definitely decided to head back home so that you can relax. You have been either in the bath or in a nice warm shower, just letting your labour unfold in as comfortable a way for you as possible. 2. You've noticed that things have begun to change. Your labour, having built up, is now demanding all of your attention. That early chatty labour has now gone, and you no longer wish to come back up to normal in between each of your surges. These sensations you are feeling are now demanding all of your attention. 3. You would struggle to text someone now. You might have been walking around with your phone earlier, messaging or chatting to friends and family, but now you find that you cannot easily hold a conversation. You cannot text or answer questions or really comfortably make decisions. 4. Your labour has now become a full body experience. What started earlier with an aching back or stomach or feelings of period discomfort has now become far larger. Your whole body is involved. Your surges are regular and very strong. You will be seeking out positions that work for you. Rocking, hands and knees, lying on your side. It isn't negotiable now. You just have to do this. 5. You've probably already moved to the quietest, smallest room in your home, and this will be really beneficial to you. You feel the need for privacy and quiet. You want to be left well alone, and you are finding people talking is aggravating. You probably prefer to have your eyes closed at this point. 6. You need to moan or sigh. You need to make noise, and you don't care who can hear. Releasing pent-up tension in this way makes your surges feel much easier. 7. You're probably feeling sick or hot or shaky, or maybe all of these things. You may also feel the need to wee or open your bowels a lot. this feeling continues to deepen as your surges are accelerating. The feelings are getting bigger and mightier. You may also now be feeling heavier and fuller in your pelvis. It's now definitely time to call the hospital or your midwife to chat about going in, or if you're birthing at home, for them to come to you. Clearly, only you know how long it's going to take for your transfer to the maternity unit. But hopefully this video will have helped to give you a better guide on how not to arrive too early. So I do hope that this video has been useful to you. Check back in with it when you're in early labour to again just use as a guide. And remember, you know your body better than anyone. So if you feel that you should be in your maternity unit at any point during your labour, then do please follow your instincts. Do let me know how you get on in the comments below, and don't forget to visit our many other videos and hypnobirthing meditations. I wish you an absolutely wonderful birth.